I'm Philip Dye with Washington Dye Associate Architects, and want to welcome you to the new healthcare bill and impacts that you can expect to see for your business. A couple of house cleaning chores, which you already know of. Valuation form, fill those out, leave them in the chair, give them to me, one to two. But we'll take care of that. We'll use those again to develop programs for 2011. As we said in the other session, we want this to be a learning experience, and we'll do a couple things. First of all, we do want to answer your questions, but if you would hold your questions to the end. This is not a political debate, so we don't need really any commentaries. You can ask questions at the end, and that would probably be great, because we want to respect everybody's time. We have very little time. We covered this more time than we need. Introduce our panelists today. Bobby Hiller, thank you for being here. Is the founder and CEO for Congress Avenue Bridge Strategies in Austin, a public affairs company that offers public relations, lobbying, grassroots development, healthcare development, and consulting services. Prior to founding Congress Avenue Bridge Strategies, Bobby served as a legislative director for Congressman Pete Sessions, specializing in healthcare issues. He also serves as the executive director of the Texas Physician Hospitals Advocacy Center and the Texas Ambulatory Surgery Center Society. Joining Bobby this morning is Gary McBeady, owner of Paget Business Services here in Irving. Gary specializes in tax preparation and consulting, financial reporting, payroll, and advisory services to small business. And Gary is enrolled to practice before the IRS. Gary also serves with many of us on the Small Business Services Committee of the Greater Irving Las Colinas Chamber of Commerce. We're going to start off this morning. Bobby is going to get our program started with an overview of the healthcare bill. Thank you.
Great, thank you. You're probably wondering how I ended up getting to speak here on this topic. I head up a couple trade associations for hospitals and surgery centers in Texas. So my goal was to figure out what do these new insurance rates, or what will they mean for them as providers? Will doctors get paid less for what they're doing? But also, they all told me, we also have physician practices. We're small business employers. We need to know what this means for our employees as well. So that's why I did a lot of digging into this. And you've heard a lot. I use an Apple that's somehow the format didn't work. That's why it's number one next to everything. It's supposed to be numbered. But the other thing is I don't get viruses on my computer by using an Apple. So that's a good trade-off. You've heard this bill's thousands of pages long. And I should start. People call it the new federal health care bill. Others call it the Patient Protection Affordable Care Act. In Washington, they're referring to it as PPACA now. So you may hear that. It's a pretty weird name. But it's ironic because this bill is thousands of pages. It'll govern what our healthcare looks like for the next decade or so. Whereas the current system, which is governed by employer-based healthcare, is just a few sentences in the tax code. So you've heard it's thousands of pages long, but my goal is to pull out just a few highlights, what you'll need to be looking out for, and Gary's going to do a much better job of telling you what it means for you individually. But a lot of these regulations are coming down. This legislation, thousands of pages long, but it's really just an outline, enabling legislation. It tells regulators what they need to do, and it's up to the regulators to give us, both the state and federal level, our guidance for the future. So you're going to hear a lot in the newspapers in the next few weeks and months as we learn more, but we'll take a look at all these issues, number 1 through 1 there. Quickly, I think this is the best way to break it up. Just look at how you're currently getting insurance. I assume most of y'all are small employers, but we'll look at all the different ones. Individual market. Big question, what's going to happen to the individual market? You've heard a lot about these state health insurance exchanges. Don't worry, I'm going to talk a lot more about that. But will the individual market die? And those of us who buy individual insurance just have to get it through the state health insurance exchanges in the future? Probably not. But I think you may have heard that the first casualty of this bill has been health insurance agents, because you typically go to an agent to get insurance. Well, if you have all these exchanges, they're pretty worried about their future. Small employers, if you have 49 or fewer employees, the key takeaway, you're not mandated to offer insurance. I will tell you there's some confusion out there. The original House bill Nancy Pelosi had would have required some employers with 49 or fewer employees to offer coverage. So that's where it stands now. 50 or more, there are penalties if you don't offer coverage. And retiree coverage, quick takeaway there. The first casualty of that, some of the big companies, they get a tax deduction for prescription drug coverage for the retirees. That went away and that made big headlines. Public employees, I'm not going to go into that, but there will be some interesting state employee initiatives. If you know people who get their coverage through state plans, some of you may have employees who do through their spouses, but we'll talk, you'll see that in the Texas legislature coming up. Not going to get into that. So what does the future look like quickly? And I'm going to go into detail on each of these. One avenue to get insurance will be Medicaid. All states will be required to cover up to 133% of the federal poverty level. That's going to mean about 2 million new people on Medicaid in Texas. So the state's trying to deal with that. There are subsidies available for you. If you're for 400% of the federal poverty level, that's a family of 4, and that comes out to about $88,000 a year. There are subsidies available for you. Now, if you're above that level, there aren't any. Small groups, quick highlight, we'll talk about this, how it works in the exchanges. I think some of these small groups, such as restaurants and hotels with smaller health insurance packages, might look at the exchanges. Large groups, they're probably going to keep their plans. We talked about American Airlines a minute ago. What will they do? We'll talk about what the exchange means for them. You've heard some talks about that. AT&T and Verizon, for example, looking at the exchanges. So here's what to expect for the individual insurance market in the future. By 2014, individuals, just like everyone else, will have to have health insurance coverage. If not, you'll pay a penalty. The penalty is not very big. It's sliding scale over a few years, but the penalties, I think it's $400 or $500 starting. Don't quote me on that. So this is where the real problem is. The insurance companies said, okay, we can offer coverage to everyone who comes to us, but you must require everyone to get coverage. That way it evens things out. Well, the problem is if the penalty is really small, people will just wait till they're really sick to need coverage. And we've seen that problem in Massachusetts. We'll see that in a minute. So the individual market, I think it'll still be around because there's some pretty good individual plans right now in the state health insurance exchanges to be competitive price-wise, and we'll talk about that why in a minute. We'll have to offer so few benefits, or they'll have to offer a certain number of benefits, I should say, but the number of providers within a network may be so small that the current individual market will still be a viable option. So if you're an individual right now, what you're going to be doing in the future, you could just pay the penalty and wait until a serious condition occurs. You could keep buying insurance in the current individual market. We'll have to wait and see if that's still around in 2014. It should be. You could go to the state health insurance exchange starting in 2014. Or you could go work for an employer with coverage, or a lot of people will go on Medicaid some people who are currently in the individual market will. So small business market, Gary's gonna tell you what this means for you and give you some examples if you're a small employer. As I said, number B there in the definition, 49 or fewer employees, you're not mandated to offer coverage. And I just don't see any changes to that in the future. So I think you're in luck there. 50 to 199 employees, or I should say 50 and more, you're mandated to offer coverage. So this is where it gets a little confusing towards the end. If you have 100 or fewer employees, you can join the insurance exchange. But if you have 100 or more employees, you have to wait until 2017. But the thing is, this is where it gets a little confusing because if you're a large company like AT&T and you drop coverage, you just pay a penalty, and theoretically your employees will just go to the exchange anyways. So that's what to look at there. What are the penalties? And Gary's going to get into this. There are really two things to look at penalty-wise. Are any of you all affiliated with a company of 50 or more employees? Just curious. Got a couple. Okay. So number one, top option, if you don't offer coverage, then you'll just be penalized for each employee starting after 30 employees who don't have coverage. The second option is even if you do offer coverage, but look at the red, and I'll explain this to you in a minute what a silver plan means. Silver plan is the key in the exchange, so remember that. If one of your employees who's offered coverage found a better deal price-wise in the silver plan, or I should say their premium would have been a better deal for them in the silver plan, then you have to pay a penalty for each employee getting that in the exchange. So those are the two things to look out for. if you're a larger employer. Number one, if you don't offer coverage period, you pay a penalty, which might be a good option for some of y'all. Or number two, even if you do offer coverage and one of your employees finds a better deal in the exchange under the silver plan, you're gonna have to pay a penalty on that. So the large employers, 200 plus in this case, you have to automatically enroll all new employees, and you have to offer qualified coverage to all employers or all employees. So I think there are two key things if you do have to offer health insurance: qualified coverage, we'll talk about that in a second, and grandfathered coverage. You may have, and we'll talk about what that means. So, new expectations. Let me skip over quickly to qualified coverage. You've heard about all these new mandates and everything. All plans going forward will have to offer minimum essential coverage. And that can be where the employee does not have to pay co-pays for preventive services, such as colonoscopies. These plans will have to offer a certain prescription drug plan. These plans will have to, there will be a cap on out-of-pocket expenses. I think it's about $6,000, a little over $6,000 for individuals each year. So you're all gonna have to offer qualified coverage if you are. Grandfather plans. President Obama talked a lot about if you like your current plan, you can keep it. Well, the bill passed on March 23rd, and the White House released rules on grandfather plans on June 14th this summer. And if you want to email me, and I'll tell you more about this and send you just a copy of this, but so we don't get into it too much. But it's a little tricky. It's going to be up to the regulators to determine if you can keep your plan or not, you the employer. But even if you change insurance carriers, that can kill your grandfather. If the copays go up significantly, that can change the copays, or that can change your grandfather. There's an estimate New York Times had that maybe around 51% of people will not have their current plan in 2013 because of the grandfather rules, among other things. So, I talked a lot about new insurance mandates. As we know, mandates add to costs. The reality is we do need to get people insured, and it's